Hannah.
Hi there.
How is it going?
Good, how are you?
I'm doing well. My name is Dr. Perez. Thank you so much for coming in. Looks like I have you on our new patient list today. So I have a couple things that I do. Excuse me while I get my pen working. I have a couple things I need to go over with you since you are a new patient. Looks like you're just in here for an annual exam today?
Yes.
Okay. Anything specific? Any specific concerns you have that you want to go over? Anything you've noticed recently since your last physical?
Just a little bit of sinus pressure.
Pressure?
And some itchiness in my ears.
Okay. Is that normal for you, or is that like completely new?
This time of year it's slightly abnormal. I would say it's very reminiscent of my seasonal allergies, but as it's winter now, I really shouldn't have that issue. It just never really stopped from the fall.
Okay. And the itchiness in your ears, that's both ears?
Yeah, the right is definitely worse than the left.
Just worse. Okay. Any drainage with that, like abnormal earwax or anything?
A little bit of flaky earwax that falls out, but nothing wet or anything like that.
Okay. So I'll definitely have a look at that. I have a tool that will allow me to look in your ear, just make sure there's nothing like a fungal infection or anything going on. So the flaking is slightly worrisome, but I'll definitely have a look. And you typically have seasonal allergies?
I do, yeah.
Okay. Any respiratory issues like asthma, anything like that? Alright, so we will go over all of that. All of your intake was already done as far as your vital signs, all that look normal. I will have a look at your temperature just to make sure there's no fluctuations going on. Make sure there are no like abnormalities there. Okay. So for a head to toe, there's going to be a couple things that we're going to go over. I'll kind of explain everything as we go. Brief test just to make sure that everything's functioning normally as far as like your cranial nerves, which are kind of like your neurological components, as well as just the regular physical stuff that we will go over. Okay. So I like to start with just kind of like an overall look at everything. So I'm going to start by having a look at you with my Penlight. It is quite bright, so feel free to just relax and close your eyes. I'm just going to graze over your face with my light, specifically looking at the sinuses for any signs of edematous areas or any abnormal swelling. Also looking at the overall musculature and any signs of kind of wasting or atrophy of the muscles. Your shoulder placement is fairly symmetrical. Just going to shine this at the top of your head, having a look at the bridge of the nose and where the shadow lies there. That looks okay. Okay, so I'm also just going to look at your fingers here. I apologize, my hands are clean. So just looking at the nail beds. Okay, so I'll have a better look at that later, but so far that looks okay. Okay, you can go ahead and relax there. So I'm going to start at the head and kind of work my way down. Do you ever have any issues with your scalp?
Some dryness, but nothing major.
Dryness, okay. So I'm going to have kind of a visual inspection here, just have a look to see if there's anything I'm noticing right away that's abnormal. So your hair itself does appear healthy, well groomed. And then as I go, I'll kind of ask you symptoms about the body part that's related to that specific examination. So any headaches or like tension headaches, pain in the head, any recent injuries to the head, anything like that?
No, thankfully, no.
So I'm just going to have a look at the scalp itself. So looking for any signs of abnormal coloration, any erythema or redness, which I'm not noting. Do you ever have any issues with dandruff?
Yeah, a little bit.
Okay. Do you use anything for it, like topically or shampoo or anything?
I use a charcoal shampoo.
Okay. So it does appear controlled at the moment. I'm not noting any signs of active flaking. And just having a look at the hair integrity, looking at the hair shaft, the ends of the hair, as well as around the hairline, looking for any signs of abnormal tension, alopecia, or weakening around the temples, which is also not noted. So I'm going to palpate around the head here just gently. Just let me know if any of this is tender, if you feel any areas of not pressure, but just sometimes behind the ears. If there's sinus pressure, you might feel a little bit of tenderness
maybe
here.
a little bit there.
A little bit there. Both sides?
It's worse on the right.
Worse on the right. Okay. Down here, is that the same?
That feels okay. Yeah, but up there it's a little bit more.
So I do feel a little bit of warmth here for sure on that right side. Any pain with the ears externally?
No.
Okay, so I'm going to grab my thermometer gun while I'm here. Just going to check to see if there are any fluctuations there. Oh yeah, so we're getting about 100.6 there. .101 on that side. Still warm on this side, about 99.5. That right side, though. Just gonna check the ear itself. How many days or weeks would you say you've been experiencing these symptoms in the right ear?
It's pretty consistent. 4 or 5 days a week.
So your temperature on this side is about 3 degrees higher than on the left, so that's definitely a possible indicator that you have an ear infection. So I'm just going to look externally and see if I notice anything. So external ear does look okay. Do you see some of that flaky wax kind of protruding the ear canal there? Do you use Q-tips to clean your ears at all?
I do.
You do, okay.
I know I shouldn't.
Yeah, unfortunately, they can kind of exacerbate any issues that we're already having. They tend to push the earwax in versus pull it out. I know it's kind of uncomfortable to leave like a wet sensation in your ears, which is why people generally use them. So they do have Q-tips that kind of look like a corkscrew, and they work better at pulling the earwax out, although I would recommend avoiding inserting anything to your ears altogether if possible. But I'm definitely feeling some warmth here. Is that painful or just tender?
Just tender. Just doesn't hurt.
So I'm going to have a look in your ear and see if I can verify that there is in fact an active infection going on. So I'm going to start with the unaffected ear. Do you ever have any issues with hearing loss, trouble hearing?
No.
So this is going to be really cold. I'm just going to have a look in your ear with my otoscope. The left side is very clear, no signs of excess earwax. The rumen is normal in color. I see a little bit of dry skin in the ear, but that's definitely normal. Any pain or pressure as I pull down or back?
No.
Okay, so the left side is definitely okay. So I'm just going to peek behind the ear here first. Definitely some reddening happening here, a little bit of swelling. And notable difference on the right side. A little pinkish in color. Definitely some flaking in the wax. And I can see your tympanic membrane or your eardrum. It is visible. normal in color, but again, it is slightly red. Okay. So I'm going to prescribe you some antibiotic ear drops. It does look like you have an ear infection. I'm seeing just a little bit of yeast in there in that ear. So antibiotic ear drops will just kind of help combat some of that. Mostly to combat the inflammation. I'm also going to prescribe you an antifungal to get rid of some of that yeast. So since we're having a look at your ears, I am going to do just a very brief test of your hearing to make sure that that's not being affected at all. So I'm going to do a couple different things. First thing I'm going to do is make a couple sounds, just snapping with my fingers. I want you to just keep your eyes closed for me. Indicate verbally whether you hear me on the left or the right, okay?
Right. Left. Both. Right. Right. Left.
Very good. So I also have a tuning fork here. It's going to make a sound just like this. Can you hear that? Mm-hmm. Okay. So I want you to tell me if you hear it first even on both sides or if it sounds different from one side to the other. Sound the same?
Yeah, it does.
Okay. Can you hear this here?
Mm-hmm.
Tell me when it stops.
Done.
Good. And here. Tell me when it stops.
Gone.
So now I'm going to test two different hearing points. I'd like you to just tell me whether or not point 1 or point 2 is louder. So this is 1 and this is 2.
One side.
Good. And this is 1 and this is 2.
One side.
Good. And does that sound any different on either side? They sound about the same?
It's probably a little bit stronger on this side.
Stronger. Okay. I'm going to try testing the function of your tympanic membrane. So your eardrum essentially is a very thin plate of cartilage, and when you hear sounds, it vibrates, and that's how you interpret sounds in your brain. So I'm going to produce a puff of air in your ear. If it's painful, definitely let me know, and then tell me how many times you hear it. Okay? So it's going to go straight in your ear.
Twice. 3 times. Once.
Any pain there?
No.
Let's go around that other side.
Three. 2. 1.
And then one big one here. Any pain there? Sensitivity?
Definitely a little bit more.
A little bit more. Okay. So there's definitely some inflammation happening in the ear canal. I don't think it's necessarily affecting your hearing. I think it's maybe just feeling a little more sensitive because you got some pain in there. So those ear drops will definitely get to working in the next few days. So I will get that script for you on your way out. So I'm going to move on to have a look at your eyes, and a couple different things that I'll be testing for this. Do you wear prescription glasses by chance?
I do not.
No contact lenses?
No.
Ever had any issues trouble seeing when you're driving, anything like that? Okay. So I'm going to start with a visual inspection of your eyes. It is very, very bright, so you can kind of gaze off into the distance. Try not to look directly at the light just yet. Do you have any light sensitivity ever? You do have very light colored eyes, so sometimes.
It's not too bad on a really sunny day. I just have to wear sunglasses.
Okay. So I'm going to come in a little closer. I'm just going to check your pupillary reflex here. Okay, so that's good. So I just have a card here that's going to allow me to occlude your vision. So just checking for direct and consensual response there, which is good. Perfect. So your pupillary reflex is fine. Have you ever been tested for color blindness or color deficiency, maybe with your optometrist?
No, I've never been to the optometrist.
Oh, okay. So I'm going to do a couple tests here. These are called Ishihara test plates, essentially just testing your ability to see different colors. They are a little tricky, so if you're not able to see a number, that's okay, but do try to let me know. Can you see a number here?
29.
In here?
74.
Here?
7. 45.
Very good, and they're going to get a little harder.
2. And there does not seem to be a number.
Very good.
16. No number, just a squiggly line.
Are you able to trace that line for me?
Mm-hmm.
Perfect. And then one more, just testing your gray.
35, 96.
Very good. Okay, so you are not colorblind. Very good news. Although I guess by now you probably would have noticed. And then you haven't been to the optometrist, so I'm just going to test a very brief visual acuity here. So about arm's length, I'm going to point to a couple letters. I'd like you to just read them out loud.
F, P, H.
And then here.
C, F, D, H, J.
And can you read the smallest line?
L, T, F, P, H.
Very good. And then if I have you hold that up and include one side, you can pick. Can you read the smallest line again?
L, T, F, P, H.
Switch sides for me and read it backwards.
H, P, F, T, L.
And can you tell me what that color is?
Green.
Very good. So vision is about 20/20. All right, so because you're having that issue with your ears, I want to have a look in your nose and in your mouth. Make sure there's nothing that could be spreading. Sometimes if you're having issues with your ears and there's an ear infection, it could actually be related to your throat or your tonsils, and it's just kind of spread to your ears. So I'm going to start here looking for any issues with the mouth. When is the last time you saw a dentist?
Oh, it's been probably around 9 months.
Okay, so not
too
terrible.
bad, no.
Did you have any issues?
Nothing major.
Nothing. Okay. Any like oral surgery, root canals?
Mm-mm.
Okay. So I'm going to have you open and say, ah. Very good. Hard palate looks good. Can you lift your tongue up to the top of your mouth? And then stick your tongue out. Move it side to side for me. And then open big, say ah with your tongue out. Good. Tonsils are good. Okay. And then one more time. So sorry. You're good. Okay. So your throat is actually very clear. So no signs of tonsillitis or anything like that back there. All right. Let me just jot down a couple different things here. I don't want to forget about your ears. So we're definitely going to do an antifungal. Are you going to be okay administering drops to yourself?
Oh, for sure.
Okay. So typically do about a 2-week dose, 2 to 3 times a day, and that should clear up nicely. Okay. So we can go ahead and proceed. So moving down, I am going to do some auscultations with my stethoscope. So I'm going to have a listen to your heart. Have you ever seen a cardiologist for anything specific, specialist?
I did have I had an EKG done once.
Oh, did you? Was there any reason that you had it tested?
I was having anxiety symptoms, and they wanted to rule out any sort of...
Everything was fine?
Everything was fine, cardiac.
Okay. How long ago was that by chance?
Oh, gosh, almost a decade now.
Oh, okay.
Yeah, a long time.
Okay. So if they didn't find anything, it's likely that were you feeling like heart racing symptoms?
Exactly.
Okay. So I'll have a listen, and I'll let you know for sure if I hear anything abnormal. So I'm just going to start here. Very strong heartbeat. I'm not hearing any signs of abnormal rate or rhythm. Maybe slightly elevated, but you are the doctor, so that's okay. Just going to listen right on your rib cage here. Can you breathe in deep for me? Go ahead and release. Very good. So no signs of tachycardia or bradycardia. I would say that your heart rate is very, very slightly elevated, but do you tend to get nervous at the doctor?
I do a little bit. Get
That's
a little
okay.
kit syndrome.
I'm just going to listen here at the shoulder. I'm just listening to your pulse here. Just going to listen over the abdomen. Did you eat breakfast recently?
I did. Yeah.
You did, okay. So just hear some normal digestion, that's good. Any issues with your bowels, abnormal bowel movements?
No.
Okay, and then if I can just have you lean forward for me, I'm going to listen to your lungs just briefly. So I'm going to have you breathe in and hold. Good, go ahead and breathe out. And breathe in and hold. Go ahead and breathe out. And hang tight for just a second. I'm going to tap on your back. When you feel me tap, I want you to say 99.
99. 99. 99. 99. 99.
Very good. Okay, you can go ahead and relax. So all of that sounds okay. Heart and lungs are very healthy. So while I have this tool out, I'm going to test a couple facial reflexes. So just going to tap in a couple different places. I'm going to have you relax to start. So you can keep your eyes just kind of very lazily closed. Good. And then if I can have you open, again, just kind of very lazily open. Good. And then I'll have you hang your jaw. Very good. Okay. Okay. Any issues with your jaw ever?
No.
Clicking, popping? Do you find that you clench your teeth?
I do clench a little.
You do. Okay, so I do see a little bit of misalignment there at the jaw, which is why I asked. And that can be normal. I'm just going to do a bit of a secondary test there to make sure that that's okay. So I'm going to hold your jaw, and I want you to just kind of move side to side. Any pain there? So hang your jaw wide open. Just tapping right on that mastoid. Any pain there? When do you find that you're grinding your teeth? Is that like at night?
During sleep.
During sleep, okay.
Mm-hmm.
Have you ever considered wearing a mouth guard?
I do have a retainer.
Okay.
I try to wear that a few nights a week.
Okay.
But,
so that'll definitely help. Unfortunately, it's very habitual, and when you're sleeping, you can't help it. So I do often recommend wearing a mouth guard, something that might be a little bit bigger. The silicone ones that provide a little more cushion. That way, if you're still tending to clench when you're sleeping, it's keeping your jaw separated just a little bit.
Okay.
Just seeing a little bit of tightness there, but it's not that big of a deal. So I'm going to use this tool to test for the pain point behind your ear there, just trying to isolate a little bit before I move down. So what I'm going to do is start with a spot that is not tender. So if I push here, that shouldn't hurt at all. That feel okay?
Yeah, it feels fine.
Just tell me as I move up where it starts to feel a little bit uncomfortable.
Probably there.
Right
Yeah,
there.
that's definitely normal.
And if I come from the top here at all?
That's okay. That's not
Right there?
Yeah.
Where would you say it's the most painful?
It was worse below. Yeah, like
Below,
right there.
right there.
Yeah, that's worse.
Right on that. And no injuries, you said recently, no falls or anything?
My dog did take me down the other night, a couple of weeks ago, but I don't fall on my head or anything.
Okay.
It was a little bit of an impact, but
Did you land on this side by chance?
no, I landed on my bottom.
Okay.
But
So
yeah,
I'm
that's
thinking this is probably likely related to the infection. It's just interesting that you've got most of the pain down there underneath that bone. Okay. Any pain or anything radiating in your shoulders? And this side is okay.
No, feels good.
Okay, that's okay. All right, move on to the upper extremities. Do you notice any weakness in your hands, arms?
No, I haven't.
I'm going to start by handing you a tool that's fairly heavy. If I could have you just kind of lazily hold your wrist up like this. Very good. And the other side. Good. Okay. And then I'm going to have you hold your arms up just like this. Push back towards me. Very strong. And then just with the wrists. Good. If you could separate your fingers for me. Don't let me close them. Are you left or right-handed?
I'm right-handed.
Okay. That's okay. All right. Not bad. I'm going to test a couple of reflexes there.
We'll get a little bit more on the fingers.
Yeah, so just relax for me. I'm just going to have a look here at the ulnar, top and bottom. So just checking at the wrist. Good. And then I'm going to have you just kind of make your fingers flaccid there. And then I'm going to check on this side. Good. And then flaccid at the fingers. Just a little bit of weakening in that third finger there. I'm going to have you grab this for me. Okay, that's okay. Grip strength is okay. Your ring finger there is just a little bit weaker on the right side.
I did break that finger.
Oh, did you?
Yeah,
okay.
when I was a kid.
Okay, so that's probably why. It just looks like you never fully regained strength. About how old were you when that happened?
Maybe like 15 or 16.
Okay, so bone structure was still developing at that age, so it could just be that your muscle tone never quite caught up. Did you have it in a cast for a while?
Just taped it together.
Oh, okay.
Yeah.
Okay. So I'm just going to make note of that old injury. Okay. Since we tested your reflexes, I'm just going to test one more. I've got a clean cotton swab here, and I'm just going to touch this to the corner of your eye. It is a little bit uncomfortable having something come towards your face. I apologize. Just look forward for me. Very good. No issues with that. All right, Hannah, so I'm going to have a brief look at your abdominal cavity here, just seeing if there's anything I feel that's slightly abnormal. So I'm going to palpate around with my hands. Very gentle palpation first, so just let me know if any of this causes you any pain. Good, so I'm going to do a little bit of a deeper palpation now. I'm feeling around for your organs. Feeling any inflammation there. So I'm going to percuss along the rib cage. And then right at the sternum. Good. Good. And then just testing for any signs of umbilical hernia there. Good. Okay. So abdomen looks fine. I'm not seeing any cause for concern there. Any issues with your lower extremities? So legs, like pain, knee pain, ankle pain?
I get sciatica.
Do you?
On the right side. Yeah.
Okay. Do you do anything to treat that?
Stretching.
And do you feel like it helps a little bit?
It does, yeah. Okay. Stretching, positional, and then trying to do a lot of core exercises too.
Any injuries that were related to that? Or?
I think it's just posture and activity level.
Do you sit at a computer by chance?
Yeah.
Okay. I'm seeing that a lot more frequently with my younger patients nowadays. They're tending to get sciatica, which before was something we weren't seeing till you were, late 40s, 50s. But with this generation of people who are sitting at a computer and then your posture is kind of hunching over, I am seeing more causes of sciatica. So I'm just going to look at your pelvis itself, just looking for any signs of misalignment there, which I'm not noting. Okay. So if I percuss here, any pain there?
No.
Same on that side? Any pain at the knee? Or at the ankle?
No.
Okay. So I'm just going to feel around your legs for any signs of abnormal swelling. So stretching definitely helps with sciatic pain. Also recommend obviously watching your posture. Easier said than done, of course.
I'm trying not to long sit right now.
Yes. Standing desks are becoming more popular too. If you can try to move around with sciatica, it tends to become worse if you're stagnant for long periods at a time. So if you can do like a walking pad, that also helps. So I'm going to test the flexibility in your legs. If I could have you bring this leg up here, good, and then bend at the knee towards the chest. Any pain there?
No.
Same thing here, bend at the knee, and then I'm going to test out at the hip flexor there. Any pain there?
No, just some tightness.
Okay. Is it the same on this side?
No, there's nothing on this side.
On this side. Okay. So definitely focus your stretching at the back of the thigh there, trying to encourage the muscle strength there, because sometimes the weakening of the sciatic nerve lower down towards the back of the knee is what's causing that tightness. Mm-hmm. So even if you get like a foam roller and kind of roll a couple times a week behind the thigh, it should help. Okay. So just briefly going to test your Babinski here. So it's going to be a little bit ticklish, so just relax for me. Any issues with your feet or your toes? Toes feel a little bit cold.
Yeah, sometimes they get cold, but no issues.
Okay. Good. Okay. So the very last thing I'm going to test today, just making sure that your neurological responses are intact. Not saying why they wouldn't be, but I do want to just do a very brief test to make sure. So I'm going to start with just a very soft sensation. This is essentially just a sponge. So I'm going to touch it to your face as well as your arms, just like this. I want you to say yes if and when you feel it, okay?
Yes. 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 Yes.
Good. So just testing the different dermatomes there. And I also have a sharp sensation. Now this is very, very sharp. It's not going to cause you any pain, but you will feel that it's pretty sharp. I'm going to alternate here. So you should feel either soft or dull or sharp. Just indicate which one you feel.
Sharp. Dull. Sharp. Dull. Dull. Sharp. Sharp. Dull. Dull. Sharp. 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 Dull. Sharp. Sharp.
Very good. And then one more time.
Dull. Dull.
Good. Okay. Did that feel any different? Did you feel it any less in any of the areas?
No, it was all the same.
Very good. So that is going to conclude your head to toe today. So the only thing I would say that I found was abnormal for sure is your ear. Definitely looks like you have swimmer's ear with a little bit of infection there. And then, of course, the weakening in the hand, I'm not particularly worried about. It looks like it's just an untreated childhood injury. It's not a big deal. If you do feel like it's affecting your dexterity or like your hand strength, could be some physiotherapy that we could look into. But if you, I mean, you've obviously been fine with it since you were 15, so. Okay, so I'm gonna get these scripts sent over to the front desk. Are you okay with electronic, or would you rather have them printed out?
That's fine.
Okay. So I will send those over to your patient portal. You should see 2 different ones. There will be directions on the bottle, but they're both going to be 3 times a day for 2 weeks.
Okay.
Okay. All right. Well, thank you very much, Hannah. I appreciate you for coming in. I would say let's do consistent TID doses for 2 weeks. If after 14 days you still feel like it's not getting better, definitely if it's feeling worse, I'm probably going to send you to an ENT.
Okay.
Okay. All right. Well, I will get those sent over for you. Should be ready very shortly in your portal. You can send them over to your pharmacy.
Sounds good.
All right. Thank you.